Now, today we'll be talking about the drug metformin. Now, metformin, as we know, is from class bicgonide. As the sulfonylureas are there, which increase the release of insulin from the beta pancreatic cells, this metformin does not cause any release of insulin, but actually it suppresses gluconeogenesis. It means okay, they reduce the synthesis of new glucose, which is unnecessary glucose, which is a very common problem in diabetes. In spite of normal blood sugars, the liver still keep on increasing the secretion of glucose. That is the reason why there is excess of glucose in the blood. So metformin suppresses or inhibits this excess of hepatic gluconeogenesis up to certain extent. That is how it also increases or enhances the insulin mediated glucose uptake and disposal of glucose into skeletal muscles and fat. And this is how it actually acts as an insulin sensitizer, and it increases the uptake of the glucose into the muscles and fat. This metformin also retards the intestinal absorption of glucose into the blood. That is how these are the all mechanisms through which it actually reduces the new glucose synthesis, excess glucose synthesis, and it sensitizes glucose for the insulin, and it increases the uptake into the muscles and fat. The problem with the metformin is it is actually one of the best medicine, one of the cheapest medicine. 500 milligram to 1 gram of this medicine can be bought in 1 rupees. So it is very common medicine, and it is almost indicated to all the patients, but very commonly nausea, vomiting, bloating, indigestion. These symptoms, these adverse effect or these side effects are very common with metformin. And most of the time, these diabetic patients, they already do have some acidity, gastritis issue. And starting such patients on metformin can again increase the nausea, vomiting, bloating, indigestion, and it can also cause mild diarrhea. So it is always started maybe in sustained release form, maybe at 500 milligram per day. Then it can be gradually increased to 1 gram, then 1.5 gram, and 2 gram, depending on the response and tolerability to the medicine. It can never cause hypoglycemia by its own, as insulin can cause, glimepiride can cause, and other medicines can cause. And it can cause lactic acidemia. That is the reason why in any failures, in any system failure, suppose any renal failure, cardiac failure, liver failure, or respiratory failure, we usually always avoid metformin to reduce the risk of lactic acidemia. It is definitely one of the best medicine to start in all the patients who have type 2 diabetes mellitus. It causes weight loss, so preferably it should be avoided in thin build patients, but that is not the absolute contraindication not to use. But in thin build patients, it can be avoided or it can also be given. That is not a problem. And definitely to all the obese patients, if they want some weight loss, then this can be one of the good medicine because it can cause weight loss of up to 1 to 3 kilograms. It causes decent HbA1c reduction of zero point 0.8 to 1.2, and this metformin is present in combination with all the other oral hypoglycemic agents in dual combination as well as in triple combination. So it comes with glimepiride, it comes with gliclazide, it comes with voglibose like Vobitem, it comes with empagliflozin, dapagliflozin, vildagliptin, sitagliptin, teneligliptin. So it is present or it comes in combination with glimepiride, gliptins, uh, and any gliptin or SGLT2 inhibitors. And it also comes in triple combinations such as glimepiride plus metformin plus voglibose, as well as it also comes in combination of this dapagliflozin, sitagliptin plus metformin. So this type of triple and dual combination is present in metformin, and that it enhances the activity of this medicine, as well as the sugar control is much better with as many less dosage as possible. So The metabolic effects of lowering sugars, weight loss, fat mobilization. This is very good. That is the reason why this metformin is also used in polycystic ovarian disease for weight loss and the metabolic effects. Usually, from 500 to up to 3 to 4 grams per day is also very commonly used. Maximally, it is used with combination medicines only. Most of the time, patient will be with a triple combination or double combination, or 2 to 3 different combinations are usually used by the patients. And most of the time, 3 to 4 grams per day is given by most of the doctors. It can also be used in pregnancy if the patient has high blood sugars or if the patient has gestational diabetes mellitus. The only problem is nausea, vomiting, bloating. In that scenario, if the female patient is not able to tolerate this metformin, then insulin is the only option. And if the pregnant mother can tolerate the metformin, then definitely metformin is used to control the sugar. But usually, the mother is always supplemented with vitamin B6, B12, folic acid, iron, and calcium as well. So, this was all about metformin today. Thank you.